Now in this section we are going to discuss about the different diagnostic methods, which methods are going to be diagnosed the infection. So there is a different methods which are these are different methods, these are different laboratory tests which are going to be used in order to diagnose, in order to detect the infectious diseases in the human beings. So the first and the one of the most important and the most commonly routine test, which is the blood test. These are different blood tests which are going to be taken in order to evaluate the human health conditions, and as well as about to diagnose the infection diseases. Firstly, we are going to discuss about what is the blood test and what are the different blood factors which are going to be involved in order to detect the infection. Blood tests. In blood tests, the first and the most careful step is to draw a blood sample. After taking the patient's blood sample, label it properly and transfer it to the medical laboratory. As we all know that one of the major and the most important step is that labeling. When we take a sample, we should have to label it properly and transfer safely it to the medical laboratory. So this step is mainly performed by the phlebotomist. Phlebotomists are those who are mainly involved in the taking of the different types of the blood or the different kinds of the body fluid samples from the patient's body, and label it properly, and it can be transferred safely to the medical laboratory for the further diagnosis. So as you can see in the step number 1, as you can see in this figure, there is a step number 1, and here there is a phlebotomist who are going to take the blood from the patient's arm, and after taking the blood, phlebotomist label the vacutainer properly and transfer it to the medical laboratory, where the laboratory technologists are going to evaluate the blood sample in order to diagnose the infection. And now the first and the most common blood test is the CBC. It is also known as the complete blood count. A CBC is a common blood test. It measures how many white blood cells are circulating in our blood, among other things. It performs to evaluate the health conditions of patients such as the anemia, infection, and leukemia. Through the CBC test, we measure the following parameters: red blood cells, white blood cells, hemoglobin, and hematocrit. The CBC is mainly involved, as you can read about in this line. The CBC is mainly evaluate the health condition of patients such as the anemic, infection, and leukemia. How the CBC will be going to detect the infection? Actually, the CBC itself does not directly detect the infection. It can provide the clues that may indicate an infection or an underlying health condition. Infection can cause some specific changes in the blood that may be observed in a CBC. For example, as you can see in the red blood cells, in the red blood cell count, certain infections can cause anemia, which is a decrease in the red blood cells count. So the next one is about the white blood cells. An increase in the white blood cell count, particularly the neutrophils, is often seen in the bacterial infection. So if the white blood cells, especially the neutrophils, are going to be increased in the CBC report, then there may be an infection. The next one is about the hemoglobin. Hemoglobin is the ratio of the blood that are mostly present in the human's body, and then there is a hematocrit. And at the end of the CBC part, we are going to perform other tests in order to evaluate or diagnose the infection. In actual, the CBC results alone cannot diagnose a specific infection. Further tests and clinical evaluation are usually required to confirm the presence of infection and identify the causative agent. The next one is about the monocyte distribution width, MDW. MDW, monocytes distribution width. It is a monocyte are a type of the white blood cell that increased in variability when an infection is present. MDW can be made as a part of the CBC. So in the test of the CBC, there is also a part of the MDW, and it is also known as the monocyte distribution width. And this part are going to be identified or or going to be represent the monocytes level in the blood. If the monocytes level are increased in the level of the blood, then maybe there is an infection is present, so there is the further infection test is going to be performed in order to diagnose the infectious agent. MTW is a new hematological parameter. It is evaluated by using the Beckman's Coulter hematology analyzer. As you can see in this figure, this is the hematology analyzer machine, through which the MTW, white blood cells, red blood cells, hemoglobin, hematocrit, different parameters of the complete blood counts are going to be evaluated through this machine. After that, there is the next method, which is the blood cultures. As you can see, we discussed earlier about the complete blood count. Complete blood count actually does not completely show the infectious result, but it can give us the different clues that maybe this patient is suffered from the such type of infection. And if we want to diagnose the infection, if we want to diagnose a causative agent in the human's blood, then we perform the blood cultures. These are the one of the most important medical tests which are used to detect the presence of bacteria, fungi, or other microorganisms in the person's bloodstream. The test involves drawing a small amount of blood from a vein, as we can discuss it earlier, usually from the arm, and placing it into a special culture bottles designated to perform designed to perform the growth of the microorganisms. As you can see, this is the culture bottles you can see in this figure. This is the culture bottles in which the patient bloods are taken and properly transported to the medical laboratory for the blood culture test. The blood culture sample are then incubated in a laboratory setting for a certain period, typically 24 to 48 hours, to allow any potential microorganisms to multiply if present. After the incubation period, the culture are examined for sign of bacterial or fungal growth. So this is about the bacteria blood culture. So it is an important test for the blood infections, because they can lead to the serious complications. If the any kind of bacteria, any kind of microorganisms are going to be enter in our bloodstream, then it leads to the very serious complications, and it may be a life threatening. One such complication of a blood infection is sepsis. If the any type of bacteria is going to be enter in our blood, can be enter in our bloodstream, then the infection are developed is also known as the sepsis. Blood cultures are collected separately from other blood tests. They are taken and more than once from different veins. It can take several days to get the results of a blood culture. So these are the main and these are the basic points of the blood culture test. After that, the next method is the CRP, complementary reactive protein. If a patient who is suffer from the any type of infection, but we don't know what type of infection it is, and maybe it is an acute infection, or if our doctors want to detect the either it is infection or not, then we perform the CRP test, complementary reactive protein. C-reactive protein, CRP, is a substance produced by the liver in response to the inflammation in the body. It is a marker of acute or ongoing inflammation, which can cause by various conditions, including the infection, tissue injury, autoimmune disorders, or other inflammatory processes. So the CRP in actually a substance. It is a substance which are mainly produced by the liver, and it is produced when there is such a abnormality in the human's body, such as if a patient suffered from the immunodeficient, if the person has some type of tissue injury or the autoimmune disease or any type of infectious disease, then these substances are going to be secreted from the liver. The body produces C-reactive protein when there is inflammation of acute infections, kidney failure, or any organ damage. It is done to check for infections after surgery. This test is mainly performed after the surgery. This is one of the just like a MCQ. You should have to remember this. CRP is mostly performed after the surgery. and it can also be performed in a daily routine life, but after surgery it is compulsory to perform it. CRP level normally rise within 2 to 6 hours of surgery and then go down by the third day after surgery. So this test will be going to be taken from the 2 to 6 hours of the surgery. If CRP levels stayed evaluated 3 days after surgery, an infection may be present. And if we take the sample of a patient who has suffered from a surgical process, and the CRP levels is going to be high after the 3 days, because it is normally going to be go down after the third day of the surgery, but it is cannot go down, and its level are going to be high after the third day of the surgery, then there is maybe an infection is present. So if we want to diagnose what type of infection is present, then we are going to use the blood culture test, as we discussed it earlier. As you can see in this figure, there is a CRP test are going to be performed. There is a CRP positive and a CRP negative. Firstly, the blood sample will be taken, and then there's a laboratory analysis, and after that there is a CRP measurement. The laboratory determine the concentration of CRP in the blood sample. After the test, we are able to evaluate the concentration of CRP in the blood sample, which are expressed in the milligrams per liter or milligrams per deciliter. These are the units in which the CRP levels, in which the CRP concentration are going to be measured in the blood sample. And after that, results are going to be interpreted in the report, and it can given to the doctor. And the last one is about these bacterial infections. What kind of bacterial infections? Those bacterial infections which are going to be very serious, such as the septicemia. Septicemia is a severe form of blood infection in which a pathogen multiply rapidly in the bloodstream, leading to this systemic inflammatory response. So it is a very life-threatening disease. Meningitis is an infection of the membranes surrounded by the brain and the spinal cord. Means these bacteria are going to be affected the brain of the human body. Endocarditis, it is an infection of the inner lining of the heart chamber and valves. Means these are those those bacterial infections which are very serious and at a very chronic level, and it is a very life threatening disease. And the last one is about the cellulitis. Although it is not a bloodstream infection itself, untreated cellulitis, a skin infection, can lead to the blood infection. If we cannot treat the infection, then it leads to the blood infection. And maybe if a patient suffer from the septicemia, they may have also the symptoms like the meningitis or endocarditis, etc. So these are the very severe form of the bacterial infections which are going to be a chronic and a very life-threatening disease also.